Now I want to talk about the male reproductive system. So structures and purposes. So we have the testicles. Purpose of the testicle is to produce sperm. So we produce a mature sperm and it holds mature sperm in the epididymis and is wait for ejaculation. We have the scrotum, which is a skin sac around the testes that help control temperature. Because if the sperm is introduced to too much heat, it can actually cause damage. So when a male gets stimulated, what happens is we have the vas deferens. And so we already have mature sperm. And what happens is when we get excited, the sperm starts to travel up the vas deferens, which is a tube-like structure. And now understand that this is just sperm leaving the testes. Goes around, then it meets up in the seminal vesicles. Now this is where we start to introduce other things to create semen. Semen, people think is just sperm. It's not. It's sperm, but sperm are very delicate. And so we have to introduce different type of fluids and carbohydrates to keep the sperm alive. So as the vas deferens connects to the seminal vesicles, it collects up more fluid. Then that goes into the prostate where it picks up additional fluid to create semen. Then the semen travels out the urethra and out the end of the penis. And that's the basic flow of how things move through the male reproductive system. Now we're going to talk about taking care of the male reproductive system. First thing you want to do is have regular checkups. Go to the doctor, have your yearly physical, make sure you are always checking the status of the reproductive health. Second, we want to bathe regularly. We talked about during the urinary system that the urethra is an opening to the rest of the body. So we need to make sure we bathe and keep it free of bacteria so that we don't get infections. We want to wear protective equipment when we're playing sports or being active. The testes are technically on the outside of the body, and so they are susceptible to having damage, potentially rupturing. We want to perform regular self-examinations. Go feel your testicles, see if anything is out of the normal, any abnormal growths. I had a friend whose girlfriend found an abnormal growth on his testicles, went in and found out that he had testicular cancer. Now we also want to practice abstinence. Make sure we stay away from unprotected sex because the introduction of STIs and STDs can lead to becoming sterile or other issues. And we're going to talk about that in just a second. You need to understand what's healthy and what's not healthy. We understand that nocturnal emissions or wet dreams are normal for a healthy male reproductive system. Just like when we talk about morning wood, that's a normal male reproductive system occurrence. And so we need to understand that that's okay that happens. Let's talk about STIs and STDs. So let's talk about chlamydia. Chlamydia and gonorrhea are bacterial infections that cause discharges from the penis and burning upon urination. Both can damage reproductive health, and treatments include antibiotics. Syphilis, which is another bacterial infection, initially a painless reddish sore appears at the site of infection. If left untreated, syphilis can spread and damage internal organs. It is treated with antibiotics. Then we have genital herpes. This is a virus that causes periodic blister-like sores in the genital area. Medication relieves symptoms, but the virus remains in the body for life. So with genital herpes, we understand that once you have it for the rest of your life, and anytime you have unprotected sex with anybody, you have the chance of passing it on. Okay, let's talk about inguinal hernias. This is where there's separation of tissue that allows part of the intestines to push through the abdominal wall near the top of the scrotum. And so symptoms may include a lump in the groin near the thigh, pain in the groin, or in severe cases, partial or complete blockage of the intestines, which when I talked about hernias before, could lead to potential death. Usually this is paired with surgery. We have sterility. Sterility is the inability to reproduce. In males, this can result from too few sperm of poor quality. It can also result from environmental hazards such as exposure to X-rays and other radiations, exposure to toxic chemicals, and exposure to lead. Hormonal imbalances and certain medications can also lead to being sterile. The use of drugs, including anabolic steroids, can lead to being sterile. This can damage the sperm and lead it so you cannot reproduce. In addition to this, STDs and STIs can lead to potential sterility. Okay, testicular cancer. This is cancer of the testicles, which a lot of times leads to having to have one or both testicles removed, making it so you can't reproduce. Then we have prostate problems. One big thing is an inflamed prostate or enlarged, we might have heard about. If we go back to our previous slide, you'll look and see that, remember, the urethra comes through the prostate and the seminal vesicles attach to the prostate, and this is what allows semen to leave the body. If this is enlarged, it can make it so, one, you can't ejaculate. Two, you may not be able to urinate because it's pushing on the urethra. So that's some prostate problems, also prostate cancer. Let's talk about the female reproductive system now. So let's talk about structures and purposes. First, we have the ovaries. So the ovaries store undeveloped ova or eggs until puberty reaches. When a female reaches puberty, the pituitary gland begins to produce hormones that cause stored immature ova in the ovaries to begin to mature. Once you have mature ova, that leads to ovulation. The egg is released from the ovary into the fallopian tube. The fallopian tube has finger-like projections that move the ova through to the uterus. The uterus is this area here. The endometrium is the lining of the uterus in which an egg will implant on. And that happens, and then during menstruation, that lining is shed, and that's what the menstrual cycle is. Then we have the vagina, which is a muscular, elastic passageway that extends from the uterus to the outside world. So we talked about the menstrual cycle. So as we are leading up to menstruation, you develop endometrium, a lining on the inside of the uterus. So a new egg is matured in the ovary. It's released into the fallopian tube and moves down. The egg travels through the fallopian tube to the uterus. After 7 days, if the egg is not fertilized, menstruation begins, which is the shedding of the lining which it was going to embed in if you were pregnant or if it was fertilized. That lining is then shed from the body. People ask a lot of times, how does birth control work? So it works in a couple ways. One is that lining never forms, so the egg never has anything to embed in. Another type is the lining still forms, but you take hormone pills to where the body doesn't recognize the egg is being fertilized, and so the lining, in addition to the egg, whether it's fertilized or not, are all shed from the body during a normal menstrual cycle. Let's talk about care for the female reproductive system. Just like with males, we want to bathe regularly. Again, it's an open orifice to the body, and so we want to make sure that we keep it free of bacteria to decrease the chances of infection. Second, just like with males, practice abstinence. We want to stay away from having unprotected intercourse or intercourse before marriage because an STD could lead to being infertile or sterile. Also, you want to perform regular breast self-examinations. You want to make sure we're checking for lumps or any abnormalities because of the risk of breast cancer. So now let's talk about problems with the female reproductive system. First, we have menstrual cramps. These sometimes occur at the beginning of the menstrual period. Light exercise or applying a heating pad to the abdominal area may help relieve the symptoms. We have premenstrual syndrome, or PMS. This is a disorder caused by hormonal changes. Its symptoms, which may be experienced 1 to 2 weeks before menstruation, include nervous tension, anxiety, irritability, bloating, weight gain, depression, mood swings, and fatigue. Regular physical activity and good nutrition may reduce the severity of symptoms. What a lot of people don't realize is males and females are not so far apart that males don't have this fluctuation in hormones as well. Men can also have a period of moodiness once a month due to hormone imbalances or hormone fluctuations. We have toxic shock syndrome, TSS. This is a rare but serious bacterial infection that affects the immune system and the liver and can be fatal. To reduce the risk of TSS, use tampons with the lowest possible absorbency and change tampons often. Warning signs of TSS include fever, vomiting, diarrhea, sunburn like rash, red eyes, dizziness, and muscle aches. Any females with these symptoms should seek immediate health care. Okay, now we're going to talk about infertility, the inability to reproduce. We have endometriosis. This is a painful chronic disease that occurs when tissue that lines the uterus migrates and grows in the ovaries, fallopian tubes, uterus, or the lining of the pelvic cavity. Treatments include pain medications, hormone therapy, or potential surgery. We have pelvic inflammatory disease, PID, which is an infection of the fallopian tubes, ovaries, and the surrounding areas of the pelvis. It can damage a female's reproductive organs. PID is usually caused by a sexually transmitted disease. Then we have STDs, sexually transmitted diseases, which are most common causes of infertility and other disorders of the reproductive system. Often symptoms of STDs are not evident in females unless a medical examination is performed. Avoiding sexual contact until marriage is one sure way to prevent STDs. Now let's talk about some other issues. So we have vaginitis. Again, we talked about itis being tagged to a word. This is a bacterial infection of the vagina in women of childbearing age. It's often accompanied by a discharge, odor, pain, itching, or burning. If not treated with antibiotics, vaginitis can sometimes lead to PID. We have blocked fallopian tubes. The leading cause of infertility may result from PID, abnormal surgery, STDs, and endometriosis. And all these are ways that the fallopian tubes can be blocked. Ovarian cysts. These are fluid-filled sacs on the ovaries. Small, non-cancerous cysts usually disappear on their own. Large cysts may require surgery, and these will be extremely painful. I've had clients who have developed ovarian cysts, and it's extremely painful. And then we have cervical, uterine, and ovarian cancer. This occurs when female's reproductive system, early sexual activity and STDs such as the human papillomavirus, HPV, are related to an increased incidence of cervical cancer. Regular checkups and pelvic exams are important for early detection and treatment. And so a lot of you want to eventually have kids, and we need to make sure that we take care of the reproductive system so that that's a possibility. Now, this is the end of this week's lectures. The worksheet for chapter 16, 17, 18 will not be due until a week from Saturday. And next week I will get into chapters 19 and 20. Email me if you have any questions.